I'll lead the business until the chair and vice chair have been elected.
Absolutely, Sarah. I mean, my term as chair is over, so I mean, it's all up to you.
Thank you very much.
No pressure.
All right. Well, good morning, everybody. Thank you for joining us today. My name is Sarah Goldrup, Deputy Clerk for the County of Grey. I can confirm that we have a quorum of members here today for this meeting of the Long-Term Care Committee of Management. Councillor Nielsen has sent his regrets, and I believe that Councillor Hutchinson is also absent today, but otherwise we have all members. Before we get into the business today, we do need to elect our chair and vice chair for the year 2024. Would there be any nominations for chair? Warden Milne?
I'd like to nominate Scott Mackey.
Perfect. Councillor Carlton?
I would second that nomination.
Thank you very much. Are there any other nominations for chair? Councillor Mackey?
I would nominate Vice Chair Sue Patterson.
Perfect. Can I have a seconder for that motion? Councillor Keaveney? Thank you very much. Are there any other nominations for vice chair? Seeing none, can I get a vote to confirm Councillor Mackey as chair for the Long-Term Care Committee of Management for 2024, please? All hands up in favor, and that is carried. Thank you very much. Can I get a vote to confirm that Councillor Carlton be nominated as vice chair for the Long-Term Care Committee of Management for 2024, please?
Councillor Patterson, not
Patterson. I apologize.
That's okay.
Councillor Patterson, can I confirm that you accept the nomination before I call the vote?
Yes.
Perfect. Thank you so much. And if I could see any hands in favor there, that's excellent. And that is carried as well. Can I get a motion to close nominations, please? I see Councillor Keaveney and Carlton. That's perfect. Thank you so much. Chair Mackey, if you are all set, I'll hand the remaining business for the meeting over to you.
I thought I got an opportunity, Sarah, to decline if I wanted to.
Oh, I apologize. Did I miss that? Would you accept your nomination now that I've locked you into this deal?
Yes, I will accept it. I appreciate being nominated by the warden, and it's certainly been a privilege to serve as chair for the previous 2 or 3 years. And I appreciate the confidence of the committee members and knowing that we have a very good vice chair ready to step in when required. So thank you very much to all. This is a very important committee, and I value the work of all the senior staff and all the staff in our long-term care homes for the work they do every day for our vulnerable seniors. So thank you very much. And Happy New Year to everyone. We will call the meeting to order. And just to remind members of the committee of your obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. Don't believe we have any delegations today. The first report is the LTCR CM0124 Long-Term Care Director Update, November 1st to December 31st. Could I have a mover, please, to get that on the floor? Moved by Councillor Keaveney and seconded by Councillor Patterson. We'll turn it over to Jennifer.
Great, thank you, and congratulations on another term as chair, Chair Mackey, and Vice Chair Patterson. Happy New Year, everyone. So I'm just going to bring my notes over here.
Sorry, Jen.
Yep.
Sue has her hand up.
Oh.
Go ahead, Sue.
I didn't, if you're speaking to me, Chair.
Okay, sorry. I thought I saw your hand. Sorry, Jennifer.
Okay, nope, that's okay. So this report is an update of the various things that have been going on at the ministry level and across the 3 homes broadly. So a number of ministry updates. In October, there was an update regarding our service accountability agreements. So we call those our LSAWs. And we expect that we will receive an extension to the 23-24 LSAW that has been signed previously. And work continues at the provincial level in aligning the LSAWs with the work of OHTs and the directives of Ontario Health, et cetera. So there's been lots of work going on over the number of years in transitioning from LHINs to Ontario Health and Ontario Health teams. On November 2nd, we received the memo with direction to move to our enhanced masking, so universal masking at all of the homes across the province. And so we were able to swiftly make that change. We had already been in the process of evaluating universal masking in a coordinated discussion with residents, families, and team members, and then this directive came into play. So we were able to quickly comply with that. End of November, there was an investment made in supporting recruitment and retention of personal support workers. So it's some additional funds to support students and an incentive for PSW graduates to commit to working into long-term care. Our partners in human resources, our business partner, are helping us to make sure that any of our staff who are currently in a program are connected with these funds if they're eligible. And we've done some communication and are looking to be able to take advantage of them and support our team members if they're eligible to receive any of that funding. December 7th, there was an announcement related to standardizing the designs in the long-term care sector for redevelopment and new builds. The hope from the province is that this will reduce duplication, save time, reduce cost. This update does not affect Rockwood Terrace redevelopment, as we were well on our way in our design, and it's already been approved, some preliminary approvals from the province before the introduction of this new process. And I think one of the key pieces to this update is really those large chains, for example, that are doing a number of redevelopments, and they've used the same designs in a number of their builds. And so it allows them to not have to go through that cumbersome process when their build design has been approved 4, 5, 6, 7 times previously. So it allows for that as well. December 14th, there was a memo related to automated sprinklers in long-term care homes, reminding of the compliance deadline of January 1st, 2025. And I can reassure committee that all of our homes are in compliance with this standard and that all documentation has been submitted. December 19th brought the memo that comes out always just before Christmas, reminding long-term care and the health system about respiratory illness, what it's looking like for this season, and then reminding us of our obligations to be prepared for respiratory illness season. For infection prevention and control strategies, on November 23rd, there was a memo about the RSV vaccine. So Ontario's launched its first RSV vaccination program for older high-risk adults in the fall of 2023. And we have incorporated that program in each of our homes. We also have worked through the process of an RFP process to identify a company to provide hand hygiene and hand care products. That is one easy sentence, but it's a great amount of work for any of you that have been involved in RFP processes. And so we've worked through that and have identified a supplier for all 3 homes that offer us the best product for the best price, as well as access to professional education tools, training, education models, auditing tools, statistics on our usage rates, and so on. And so we have been moving that program into place. In a finance update, end of November, the province released a memo updating some additional funds in supporting professional growth. So the ministry is providing additional funding to support professional development. This has been amended so that expenses related to leading delivery of in-house training to eligible long-term care staff are considered as well. So the catch with this funding is that it is only available until March 31st of this year. And so as we're working through the budget process, which is being revisited again by council this week, we'll be able to then determine where these funds may provide some offset to some of the budget decisions that have been made. So it's a welcome investment with a short time frame. So we'll need to act quickly in how we utilize it. Staffing and training. This is really exciting. We received funding from the PrEP LTC student placement program. And with that funding, we have been able to recruit a student coordinator, a long-term care student coordinator, who's focusing on recruiting Color It coaches, updating our student orientation program, and identifying areas for improvement, creating new partnerships with the colleges. So on December 11th, we were notified that our funding for this program has been extended to 26-27, which is really exciting. And in addition to that, or as part of that work, we now have 36 team members who have put their hands up to say they want to be Color It coaches. So these are people who will have a little bit of extra training to really enhance the experience of our student placements. So when students come in PSW, RPN, RN, and they're on site doing their placement and practicum, the Color It coach, we have funding to have them be backfilled so that they can dedicate their time in orientating and working with the students to give them a really great experience. And we're hoping that that will encourage people to stay in a career in long-term care. So that's really exciting. We've also been doing some lean training in our back office, back of house work. And so we've been working with the business office team members, looking at some areas that were identified as high priority. Our next steps are implementing some plans and working on some timelines. And we were looking at ways to streamline some of our processes, like onboarding. So the time it takes from someone being offered a position to having all of their orientation and all the paperwork, et cetera, completed, and really streamlining some of that work and eliminating duplication and et cetera. So that's exciting work as well. Wellness continues to be a focus in all that we do, and there's a bit of an update there. Accreditation has been chugging along, and some exciting news. We now have our dates for when the surveyors will be on site. So the Accreditation Canada surveyors will be at our homes May 27th to 30th. While they're on site, they will assess the performance of our organization against standards of excellence and identify opportunities to achieve improved performance. They'll also conduct an assessment that will include discussions and interviews with residents, families, and staff. So there's lots of work still happening as we prepare for that. The Fixing Long-Term Care Act. I just want to highlight here, and there was a link to a letter that has been sent. So on December 18th, Advantage Ontario, which is our association, requested that the long-term care sector support their advocacy to the Senate to stop Bill C-295. This is an act to amend the criminal code, specifically around the neglect of vulnerable adults. This bill recently passed third reading in the House of Commons and has passed first reading in the Senate. And Grey County Long-Term Care supports this advocacy, and a letter was submitted to the Senate on December 20th. Happy to answer any questions if people have any questions about that after the letter was included in a link here in the report. We aren't, of course, we're not opposed to the work that needs to be done in making sure people are safe in long-term care. But what's proposed is just higher punitive charges and criminal charges that really don't get to the crux of the challenges that are happening in long-term care. And so the advocacy is looking for investing their time and efforts in supporting things like the national standards and quality care, as opposed to a punitive approach to dealing with those challenges. An update on our behavioral support transition unit. So the BSTU interim report was submitted to the province on December 11th. And that report has also been linked here in this update. Lots of amazing work happening by the team at Grey Gables, supporting those residents with highly specialized needs. And I'll just highlight a couple and some of the recommendations that came from this interim report. So the BSTU, there's some work that we still have to do in promoting the BSTU applications within hospital care coordination and discharge planners, so that people are aware of the service that's available at Grey Gables. We have also requested in that interim report sustainable funding, so that we can continue to work towards providing a center of excellence in rural Ontario. We really do believe that the BSTU can help support some of the pressures of ALC, individuals who have been identified as ALC, and that we're well on our way in creating a model that can be replicated in other communities to spread the improvement and really enhance these services. When we look at the statistics for ALC patients in hospital, a number of those individuals are in hospital waiting for long-term care, or perhaps not being accepted into long-term care because of enhanced behaviors that need some additional support. And finally, we continue to work with our partners across the sector. We submitted 2 proposals to the Advantage Ontario Convention, featuring one is featuring Rockwood Terrace Revitalized, building a rock-solid future for person-centered care. And then a second submission was on the trust and positive relationships empowering staff and families. And we were notified by Advantage that the submission supporting the empowerment of staff and family relationships has been selected. And so I will be joining Deborah Bakhti as guest speakers at the 2024 convention. And we recently were contacted by Advantage to see if we would consider presenting our redevelopment proposal at a virtual webinar in the spring. So that's really exciting, and stay tuned. I can provide you more information as we get it. And that is the update. And I thought that it would be quick, but apparently there was a lot going on in the weeks just before the end of the year. So thank you.
Thanks very much, Jennifer. Certainly a lot of information. Any questions from committee members? Warden Millen, go ahead, please.
Oh, you're on mute.
There we go. I'll plead I'm out of practice. Thank you, Mr. Chair, and thank you, Jennifer, for that report. Indeed, there was a lot going on. In terms of the accreditation process, is there a role for the board in that process?
Thank you. for your question, Warden Milne, and through you, Mr. Chair. There is, in fact, there's a governance section, and it's on my list on my sheet in front of me is to connect with the deputy clerk to talk about the next steps in engaging with our members of our governance to arrange a time to go over some of those standards and to work through some of that assessment.
Thank you very much. Yeah, that's exactly what I was looking for, because I know a local hospital board that I sit on, the accreditation process, there is a very significant role for the board in that process. I was wondering if there was the same here. So it sounds like there is. Thank you very much.
Thank you.
Councillor Keaveney. Shirley, go ahead, please.
Thank you, Mr. Chair, and congratulations on your reappointment, and Happy New Year, everyone. Jennifer, thank you for the report. And I just wanted to go back, if I may, to your mention of the hand hygiene program and the RFP process for new products. And I just wondered if you could delve a little deeper into that, because obviously we've been using those products all through the pandemic, and how you see practices changing, and perhaps, you know, the education tools that you mentioned, how they might alter or be different than what has been happening throughout the pandemic.
Great, thank you. Thank you, Councillor Keaveney, and through you, Mr. Chair. I think ultimately one of the best outcomes of the RFP is the consistency of pricing and product across all three homes. So our policies and procedures and our ordering can be consistent across the three homes. And then it allows us to be able to track usage and that kind of thing. And there's a lot of things that go along with products like that in terms of the WHMIS sheets and health and safety and where they're located and all of that kind of thing. In terms of the education, I might turn it to Renata or Dena. They were really actively involved in leading the RFP process and working through that with the leaders from the homes. Dena, I saw you take your microphone off.
Yeah. Yes, thank you, Jennifer, and through you, Mr. Chair. A really good question, because part of the process, while we were through the pandemic, we also ended up with brand new IPAC standards. And so prior to the pandemic, we didn't have as comprehensive requirements for IPAC, the hand hygiene program. So going out for an RFP also took a look at where placement is in terms of what we needed to evaluate certain programs. So when you're talking education modules, it is a matter of we've been very fortunate with Public Health Ontario to have education modules, etc. But this is at that placement. So we are doing point of care risk assessment. When is the ideal time? What does that look like? The other part is when you're looking at a hand hygiene program, it's that each one of those products in terms of level of pH, for example, in terms of skin integrity, right? So contact dermatitis if you're using it. So the compatibility of every hand hygiene product lends itself to one another. During the pandemic, as we all were struggling to find some ABHR, alcohol-based hand rub, soaps, etc., we had a variety of different products. So this way, it is a suite, so to speak, from soap to ABHR, both what would be available for residents in spaces, to also those that are compatible. There's some the product that we got, we were struggling with some employees to find things that wouldn't cause contact dermatitis. And we also have a great deal of staff satisfaction with the new product we're bringing on, because it has reduced some of those, as well as moisturizer. So you don't just use any hand cream because it can create a barrier. You have to use one that's compatible with ABHR. And we've also, along that fleet, we added sunscreen as well. So there is a science to hand hygiene, from the product to the process, as well as the ability with technology to calculate quantity and volume it's really become quite a niche, but also then we can get that as real-time data. So we're quite pleased with it. And to be fair, the price with that fleet has been quite positive and with minimal, if any. The other part that comes with this product is an IPAC professional and hand hygiene from the company. So that's also where sometimes it's nice to have unique things where this is their area of expertise. So unique and novel ideas to do the same thing about how we do hand hygiene. So it can be fun as well. So we're looking forward to that whole program. I hope that answers your question.
If I may, thank you so much, Dana. That was really interesting and informative. And as always, it sounds like you're on the cutting edge of a new program that could be, who knows, spread out across the county into other scenarios. So thank you.
Yeah, thank you.
Any other questions for Jennifer? I've got a couple, Jennifer. The good news story that you went over in regards to the personal growth fund. We've all got budgets on our mind, and is that approximately $300,000 that will be available for personal growth? And how many staff do we think will be able to utilize some of those funds for advanced training?
Oops, thank you for your question, Chair Mackey. I don't think it's that much, actually, because
No?
it's per bed per month. And I see Marcus is on the call as well. And so we're still in the process of just sorting out where the opportunities are to use that funds. We had training in mind. We did make some reductions in training as part of our budget process. And so we'll be able to offset some of those reductions that we made so that we can continue with some of our pre-planned training initiatives. Marcus, do you know offhand the total that we're expecting?
Yeah, through you, Mr. Chair. I'm just opening it up right now. The other part of it too is that we have a lot of training that we do that is well and beyond the funding amount and that kind of stuff. So we have a lot of eligible expenditures that we could apply this to. But when it comes to the professional, it was, so for Lee Manor, this is just one so that we can kind of show the example now. It was an additional $1,200 for our largest home. So everything in respect is lower than that.
Okay, so it's not a big amount.
No, we will be seeing that little bit increase also for the January to March, but we did receive the intro amount for December and that, so we are seeing it for a little bit. Still great to have expenditures that we can apply to it, or new training that can come up to utilize it for sure. But no, it's not a staggering amount by that stretch.
All right, thank you. Jennifer, the other question was in regards to the investments for the recruitment and retaining staff. The $10,000 that's available for relocation costs for PSWs, we would be included in the rural Ontario part of that. We'll be eligible for that.
Thank you. And through you, I do believe that we are eligible for that. And I don't think we've had anyone that has met the criteria join the team, but our HR team has this there's a number of little incentives that have been introduced over the past number of years. So we have a list of things that we might be able to link new team members or potential staff with to be able to recruit them and retain them. But I don't believe we've had anyone eligible for that at this point.
Okay. Well, anything that will help with the recruitment is good news. So I'm glad to see that's there. And my final question, Jennifer, is in regards to the mandatory sprinklers. Do you have any idea how many beds will be lost in Grey and Bruce from the smaller homes because of that implementation?
I don't. I don't have a sense. I know through my work with Advantage as a board member that out of the Advantage membership, which is not-for-profit, charitable, and municipal homes, that there are only 5 homes that aren't meeting that compliance requirement, and that a number of those 5 are actively in the redevelopment process. So they're sorting that out. You know, are you going to spend, you know, a significant amount of money to do sprinklers when you are moving everyone in 8 months or 18 months? Like, what does that look like? But I don't have a sense in the private sector.
Okay, thank you. All right, if there's no other questions, all in favor of receiving Jennifer's report? Sorry, Dana, did you have your hand up?
No, I don't. I don't see it, so.
No, I see a hand in front of you, but okay. All in favor of receiving the report? That is carried. Our second report is LTCRCM 02-24, the long-term care operational report, October 15th, 2023 to December 14th, 2023. Can I have a mover to get that on the floor, please? I think I may be having some internet problems because I'm not seeing any hands coming up.
Through you, Mr. Chair, if I may, I see Councillor Carlton's hand and Councillor Keaveney's hand.
Thank you. All right, Jennifer, who is going to take us through the operational reports?
Thank you. So the team has reviewed the report and are each taking a section and will pass it off to each other. So Renata is going to start.
Thank you.
Good morning and Happy New Year. As always, the Canadian Institute for Health Information releases its data on a quarterly basis, and the second quarter data for July to September was released. The care communities continue to work on their quality improvement projects, and in this quarter, Rockwood Terrace either met or exceeded the indicators for the province, and for Grey Gables and Lee Manor, the BSTU residents' care needs have an impact on the data, as well as Lee Manor had several high acuity residents that are reflected in the data. Since this report, the results from the resident and family experience survey were released, and I will be bringing a report on these results at the next committee meeting. For accreditation, while we are actively working at preparing for accreditation, there are several teams and groups working on accreditation standards and our quality improvement activities. We're reviewing our current practices. We're reviewing our policies and procedures. Communications have been out to residents, families, and staff about accreditation, and will continue over the next few months. So it will be a very active next 5 months, and stay tuned for more information. Are there any questions?
Well, congratulations, Karen and Rockwood Terrace for first time I think I've ever seen all green. That's great. Warden Mellon, I see your hand.
Thank you, Mr. Chair, and thank you, Renata, for your comments there. In regards to the quality indicators, I mean, it's good information, but for myself, I'd like a little more context in terms of the numbers for our own homes. Are those indicators, all those various percentages, it would be a little more helpful, I think, if I could understand, are they getting better? Are they getting worse on a rolling average sort of thing? Like in the last 6 months, has that number got better? Has it got worse? Is something like that possible?
Yes, sorry, through you, Mr. Chair. Yes, it is, and I can prepare that for the next meeting. The numbers that are reflected in red, which are above the provincial average, have not substantially changed over the last few quarters, and they are very much reflective of the care needs in the homes. For example, worsening activities of daily living has not changed at all, and it is reflective of the acuity in of the residents' care needs. A lot of work is done on antipsychotic, and again, it's dependent on the residents. And for Grey Gables, it's very much the BSTU care needs, the residents' care needs in the BSTU. But I can certainly provide an overview of the last few quarters at the next committee meeting.
Perfect. Thank you so much.
Renata, should the BSC be compared separately when they have, you know, higher needs, especially around some of the psychotics?
Unfortunately for this data, it can't be broken out. It's all rolled together in the homes data by CIHI. And so I can't easily break that out. There is raw data for the BSTU available that shows the needs of the residents, of those 20 residents.
Thank you.
Yeah.
And I'll just also add, if I might,
Yes.
Mr. Chair, these are the publicly reported indicators as well. So if any member of the public wished to go do a search, these are the indicators, the numbers that they would find publicly reported. And so we thought it was important to also include that as part of our operation report at our committee meetings.
Okay, thank you. Any other questions from committee members? Shirley, go ahead, please.
Thanks very much, Mr. Chair. And just along this same theme and looking at the worsening mood and depression numbers, and I realize that is related to the acuity, but I wanted to ask, as we ramp up to the full 4 hours of care, do we think additional care for the patients may help to improve those numbers?
I'm
Who's
sorry.
taking that one? Renata.
I think it certainly can, because there will be added attention to the residents by the staff, and some of it is very much individually based on the resident, on how the resident is coping in long-term care. But certainly with increased staffing, there should be an opportunity for more one-to-one support for the resident. I hope that answers your question. I hope that will be the result.
I hope so too, Renata. Thank you.
Thank you.
Any other questions on that section? All right, Jennifer, we can carry on.
So I'm up next, and through you, Mr. Chair, and if I may add a bit more context, like these are one indicator, like one set of indicators that we use as we look at the resident care that we deliver and what we can support. So and it is a point in time data, as they've said, in terms of provincial numbers, but we're constantly with our DOCs, ADOCs, resident care coordinators looking at what the residents need, how we can best meet those needs, and continuing to address as we can take a look at that. And as in 2023, as Renata shared, all 3 homes did engage in several home-specific QI projects, including skin and wound program, and we saw some really significant improvements, not only in the assessment, but we did some training with PSWs for early identification as well, falls prevention, medication management, and pain management, so we can do some additional assessment skills. And we've shared those throughout the last report, and these are the clinical projects that we continue to look at as we prepare for accreditation this spring. And it's been quite refreshing to know that our programs are in good stead as we do the assessments to see where the gaps are. So quite pleased with where we are. And again, seeing that these numbers are one point in time, we're really pleased with where the progress we're making. We also had 2 county-wide clinical initiatives to improve resident outcomes using technology, and I've I've shared this before in other reports, but the first was Project Amplify, which is that data integration to support our residents during care transitions between the hospital and the long-term care home. And that has now been fully realized as it's going out provincially, but for our region. All the training's been completed at our care communities, and the technology is in place in our EMR, electronic medical records. And just this morning, I looked at a care summary for a resident that gave real-time information to support communication of the health information from the resident who came back home from hospital. So it was really nice to get that as one tool with Project Amplify. The second is the machine readable coding, and this is the barcode scanners, and they're now located on every medication cart to scan the medication package to ensure the accuracy and alignment. Now, of course, that doesn't forego the requirements of our registered staff to meet their requirements with the College of Nurses. It's just an enhanced tool, and we're finalizing the implementation of the project at the end of this month. And our plans for 2024 include enhancing clinical practice with technology, and peer champions are throughout our homes to enter into a 3-year project with the RNAO and the implementation of best practice assessment tools. And that really nicely aligns with the Fixing Long-Term Care Home Act regulations and accreditation. And it's been quite a rewarding process as we're doing these gap analysis to identify that we are hitting so many of the requirements, and impressed RNAO with our color it and resident-centered care approach, so much so that they are looking into to hearing more about it. And also our IPAC and Wellness leads will also be leading the implementation of an electronic surveillance system for infection prevention and control. So using technology that can do the data surveillance and pull reports for us, and enhancing us identifying early issues as well as trends. So thank you.
Thanks, Dana.
Good afternoon, or sorry, good morning, everyone, and Happy New
Hi,
Year.
Karen.
Hi. Through you, Mr. Chair, I'll be covering the next couple sections of the report. Ministry of Long-Term Care inspection officers attended both Lee Manor and Rockwood Terrace during the reporting period. At Lee Manor, they arrived to follow up on some critical incidents related to falls prevention, medication management, and a complaint related to infection prevention and outbreak management. And through their report, they had no findings related to those areas. They also attended Rockwood Terrace to do follow-up on critical incidents and they always review infection prevention and control. As a result of our inspection, we were issued 2 non-met standards related to duty to report and reporting certain matters to the director. So these were a result of a late critical incident, and I'm going to talk about those in a minute, but the specific critical incident was a few hours late being reported, so they issued that, as well as the fact that we identified some abuse had occurred, so they issued on that as well. Both instances or occurrences were followed up at the time and addressed as a result of the investigation and outcomes. Next is the list of critical incidents that were reported during the reporting period. As identified, we have quite a lengthy list, as you can see there, of items that we are required to report, sometimes immediately, and they do mean immediate. Sometimes it can be the next business day. So those are listed there for your review. Just a reminder that abuse and neglect must be reported even if it's just alleged. So we don't have the opportunity to investigate it first and then report. It's if someone says those words, basically, we're on it and are required to report immediately and then investigate afterwards. Also listed there in a number is our disease outbreaks, and they are outlined on the following page. All 3 homes experienced outbreaks during the reporting period. We believe this is a sign of the times and something that we will be enduring on a fairly regular basis as we move move forward between influenza and COVID and RSV and the common cold. There seems to be always something going around. So those, as I say, are listed in detail on the following page. And I think Stacy is up next.
So just before we move on to Stacy, does committee members have any questions for Karen? I was just wondering, Karen, the unexpected death, that we had 2 of them. Can you elaborate a little bit more on that?
So I guess I'm going to ask the question, can I elaborate a little bit more without going into closed session? So just some general.
Just
Yeah. Okay.
just general.
So through palliative care, currently we have an opportunity to identify if a resident is nearing their end of life or palliative care. So residents or incidents that are reported here would be a resident who hasn't been identified as nearing their end of life or experiencing or needing to experience palliative care. And it may also, we've been caught on if a resident has had a fall in the previous time period and then has experiences death, it is something we are required to report as an unexpected death.
Thank you for that clarification. All right, moving on. Shannon?
I think it's
Actually,
sorry.
Hi, Stacy.
It'll be me. Yes.
Hi, Stacy. Go ahead, please.
Hi, thanks, Karen, and good morning, everyone. Through you, Mr. Chair, it's my pleasure to highlight a few of the events and projects that provide opportunities for our residents to be active, social, creative, and engaged in our care communities. This reporting period marks several events that residents enjoy celebrating, including Halloween, Oktoberfest, and of course, the holiday season. In collaboration with residents, the recreation teams develop some fun activities to honor these special occasions, including costume parades, parties, theme meals, festive baking, crafts, home decorating, and community outings, to name just a few. Our ties to the community organizations were also evident with Legion members supporting Remembrance Day services and visits with veterans in our homes, as well as visits from youth groups sharing their companionship and special talents like the Owen Sound Dance Academy and the Lions Club Twirlettes. The opportunity to engage with the younger generation always seems to evoke a magical response from the residents, and one they always look forward to. And it's not only rewarding for the residents themselves, but for the staff who get to see the residents' joy from these very special interactions. We're very proud and grateful for our recreation teams who do a great job coloring it for our residents, and look forward to highlighting more fun programs into the new year. And I'd also like to highlight the environmental section of the report. Each of our care communities is dedicated to emergency preparedness and meeting our legislative requirements. And in doing so, each of our homes conducts monthly fire drills and on all 3 shifts, and also reviews emergency responses to specific scenarios known as universal codes. Each care community has a plan into 2024 to ensure continued compliance with these emergency requirements.
Thanks very much, Stacy. Always nice to hear all the special events that are occurring within the homes. It's my favorite part of the reports. Any other questions for Stacy before we move on? All right, who's next in the queue?
I'll turn it over to Kim.
All right.
Hello, hello, everybody. Through you, Mr. Chair. I'm Kim Mustard, just in case anybody has not had the opportunity to meet me. I am just at the end of filling in for Shannon as she transitions back into her role as executive director, and now that she's back up on her feet. So like I said, I'm slowly transitioning out, but I am here today to do compliments and colored stories. So all 3 homes were very lucky to receive many compliments and accolades through the holiday season. We're so fortunate to have families give us treats and goodies and written notes of how much they appreciate what we do. We gather colored stories, as you know, through meetings and through this committee report. One I was going to highlight today was the story from Lee Manor. So when a resident passes or moves, Staff will often feel the loss of relationships that they've established with both the resident and the family. In recognition of this, the home implemented a new support initiative called the Lean On Me Huddle. It's led by the social worker and the associate director of care, and it gives the staff a safe environment to share their thoughts and their feelings with their fellow staff members. It creates an atmosphere for the staff to reminisce and express their thoughts and feelings and loss. Staff have expressed their appreciation for the opportunity to recount memories, and some even coming in on their days off. So we find this is a perfect example of coloring it for the staff by providing them with a safe outlet to acknowledge and express their feelings. So any questions or comments about that?
Thanks very much, Kim. Some very heartwarming stories there. Any questions for Kim? And welcome. And as you're transitioning out, we appreciate the time and effort you spent holding down the ship while Shannon was off.
Thank you. It was my pleasure.
All right, that takes us to the end. Is there any final questions from committee members? Warden Millen, go ahead, please. You're on mute, Warden.
There we go. Sorry about that. Thank you, Mr. Chair. And I'm not sure who the question should be directed to, but I'm wondering wait list numbers for the various homes. Do we have any indication of our lists getting longer, shorter? Are they turning over quicker, shorter? That's kind of what I'm looking for. Who would be?
Oh, good. Karen.
Or Jennifer, Karen.
Sorry, through you, Mr. Chair, just because I had a conversation with Terry about this yesterday. Ours is currently at 150. It's been high like that for probably a year now. And the highest we've ever seen, like Terry's been here almost 30 years and she's never seen it that high. So higher than normal, but stable over the past year for us.
Right. Okay.
Thank you. Kim, do you have a sense? Yeah. Oh, you're on mute.
Thank you. We're seeing the exact same. I actually just looked it up. We have 175 people on our wait list, which again is higher than what we've seen in the past, but definitely has stabilized over the last number of months or even closer to 6 months. Our BST wait list is currently sitting at 4. So, which is actually not bad. I mean, if you look back a year ago, we were sitting with some empty beds. So the fact that we have people that are taking advantage of the system that we have in place and will be able to jump into those beds when available, that's great too. So.
Yeah, thank you. Is it the same, Stacy, at Lee Manor?
Yes, through you, Mr. Chair. I don't have specific numbers, but I can concur that our trends are exactly the same. Yeah.
And we can talk a little bit about some of the placement legislation with the correspondence that's coming up in the meeting as well.
Okay, thank you very much.
Jennifer, do you have any sense how our high wait list numbers compare with the privately operated homes?
I don't, because the most recent published waitlist numbers, I know I was doing a presentation not long ago. I'm trying to remember what it was for, that included that information. Oh, for the physicians, Stacy, for Lee Manor's group, physician group. And the waitlist data that was published was May of 2022, I think, is the most recent published data for Southwest and Grey Bruce. So nothing new has been released publicly.
Okay, thank you. Any other questions? All right, all in favor of receiving the operational report? And that is carried. Thank you. Next report is LTCRCM 03-24, the heat exchanger replacement at Lee Manor. Jennifer, who is going to take this? Stacy? Go ahead, Stacy. Sorry,
Thank you.
Can I have a mover to get it on the floor, please? Moved by Sue, seconded by Sue. Patterson and then Carlton. Go ahead,
Thanks.
Stacy.
Thank you. Through you, Mr. Chair. This report is being presented to committee for your information and outlines the heat exchanger replacement project and associated costs. Back in November of last year, a small leak was identified in one of the two heat exchangers at Lee Manor, which operates as the hot water tank backup system. At the present time, we are currently utilizing this system as the primary domestic hot water supplier until our hot water tank is replaced. And unfortunately, the hot water tank installation has been delayed due to supply chain issues. To ensure safety and continuity of operations, it was recommended to replace the heat exchanger as soon as possible to avoid any further system failure. We proceeded with an emergency purchase as this project met the criteria as outlined in Grey County's purchasing policy. And after consultation with the manager of long-term care finance, it was recommended that the Lee Manor heat exchanger replacement and installation project, which was initially scheduled for 2030 budget, be reflected in the proposed 2024 capital projects budget for $12,000. So that you would have already seen that in the document that was presented for budget in the upcoming year. And the estimated amount for this project is $11,732.79, including tax. And since writing this report, I can confirm that last week, both the hot water tank and the heat exchanger were delivered to Lee Manor, and we're expected to have those installed by the end of the week.
Okay, thank you. Any questions on that report? Warden Millen, go ahead, please.
There we go. Got the microphone that time. Thank you, Mr. Chair. And Stacy, I'm wondering, the supplier of the new heat exchanger, is it the same supplier that supplied the one that failed?
It is correct. That's correct. Unfortunately, there's very limited suppliers. This has to be like a custom built item. And through the process of reaching out to all of the people who bid on the project, actually all was going through the same supplier. So it's very limited, unfortunately.
Okay, thank you very much. And I'm certainly not questioning your report or any staff here. It's just, well, I won't say anymore. Thank you.
I will say, if it helps, we are sending the other tank back so that they can do some investigating to see if there was something faulty in the tank that we did have.
Very good. Thank you.
Stacy, is there a general life expectancy for these tanks?
There is. I'd have to have another look at the BCA, but clearly this was well under the expected life expectancy. Yeah.
All right. All in favor of receiving that report for information? And that is carried. Thank you. Is the requirement, Jennifer, a closed meeting? No requirement, no closed meeting today. Correspondence. We have the correspondence from North Perth. Have a motion that the correspondence from the municipalities of Shunanai and North Perth regarding the request for support of Bill 21 fixing the long-term care amendment act till death do us part be received for information. Can I have a mover for that, please? Moved by Warden Millen, seconded by Member Carlton.
You, Mr. Chair, I apologize. Before you call the question, I think Director Cornell might have had some comments to make on the correspondence.
Yes, thank you. Jennifer.
Thanks. Thank you, Mr. Chair. We listed this on the agenda as to be received for information, and then have some discussion and let committee decide whether they want to take action or not. I'll just give a little bit of background context. And so, Deputy Clerk, that happens before the question is called. Is that correct? It doesn't need to be put on the floor. I see some, oh, there she is.
I believe it's on the floor now,
It is,
Jennifer.
okay.
So we'll take the information and then
go from there.
And then we'll get comments from the committee and see what steps they want to take.
Okay, great. Thank you. And so you'll see the letter from North Perth that is requesting that fellow municipalities support the Bill 21, Fixing the Long-Term Care Amendment Act, Till Death Do Us Part. And it provides some background as well. And I'm just going to share what the actual Bill 21 is asking. So it's a private member's bill that is proposing an addition to the Resident Bill of Rights that include this language. Every resident who requires care and is admitted to the home to receive that care has the right upon admission not to be separated from their spouse and to have appropriate accommodation made available for both spouses to live together in the home. And so that's what the proposed private bill is talking about. I just want to give a little bit of context. So the matter of spouses being separated is a concern, and it is something that we pay attention to and talk about and work to. There's actual spousal reunification language already. The Resident Bill of Rights stands as a fundamental principle of the Long-Term Care Home Act, and prioritization for admissions to long-term care home is defined in regulations. So there are regulations that establish clear criteria for prioritizing. So there's category 1 that's labeled as crisis, and that gives top priority to residents that are in hospitals or in community facing housing insecurity or crisis in the community. So those individuals waiting for long-term care will be listed as category 1. Category 2 includes the reunification of spouses. So currently, most of our admissions are category 1 from hospital or community, but mostly from hospital. Pre-COVID, our admissions were more balanced and were closer to 50% category 1, 50% category 2. This proposed bill amends the Bill of Rights, but doesn't speak to any of the other regulation around prioritization. So there's a lot of work to be done in updating language around criteria and prioritization. I can confirm that both the Residents' Council of Ontario and Family Council of Ontario have addressed and done advocacy around the concern for having a resolution for spousal reunification through their various public policy departments. There are many competing priorities, and everyone needs equitable access to long-term care. So I can also say that the province has been doing some task force groups and seeking information around admission criteria. And another piece of the advocacy that Advantage is doing is around admission and prioritization for culturally specific and language specific long-term care homes, as well as like behavioral supports, specialized care, as well as campus of care. So right now in Ontario, a campus of care, you live in perhaps the retirement or the senior living, and you are ready to transition to long-term care, you can't automatically transition from the campus that you're in to the long-term care campus and stay within the campus. So there are a lot of moving parts with the legislation around admission, criteria, prioritization. And so that's why this has been presented to be received for information at this stage, with staff recommending that consider it for information, and that I think there will be more to come, and that perhaps amending the Residents' Bill of Rights doesn't achieve the goal of what's actually needed. And there is language already around spousal reunification, but if we need to get into that into more detail, I'll need to defer to Kim or one of the EDs, because it's been a little while since I've supported somebody with spousal reunification. So that's so is there any questions or discussion around this correspondence and the request from is it North Perth? Yeah.
Sue, go ahead, please.
Thank you, Mr. Chair. I guess, Jennifer, what I would wonder, how important is it for us to support this? And if there's more information coming, I would definitely wait for that. And the reason I bring it up is because just before COVID hit, my mother was already in long-term care in Bruce County. My father chose to go in, and under spousal reunification, kind of moved to the top of the list to be able to get in. We were fortunate in that the adjoining room to my mother had just become open as Dad applied, so they got to go in together. Now, my mother passed away this past September, but Mom and Dad had celebrated 70 years of marriage last February. So for them to have been parted that many years into a marriage would have been devastating for them. It was hard enough when Mom was in and Dad wasn't. So I see the benefit to having that spousal reunification, but I also understand that there's other people maybe with more critical needs for being in there. So how does one play one off the other? And is there steps or information that will be coming forward for us on that? And thank you.
Yeah, thank you. And my condolences on the passing of your mom. This is something that we've been working on, and within Grey County supporting reunification as quickly as we can for years. I can say that I did a little survey of my colleagues in other municipalities around, and they have just received this for information. That's what they've done. They haven't done a formal support for the advocacy of it. I don't know, Karen or Kim, do you have any comments in terms of spouses, any recent experience with spouses being separated or brought back together?
I can speak a little bit to that in the sense that because the spousal reunification priority falls below the crisis, we're not seeing those spousal reunifications happening through COVID and post-COVID like we were before the pandemic. So I know currently we have a spousal reunification kind of on our wait list. But if I looked at our wait list, we've probably got 20 plus people on the crisis list that will need to come in before the lady who lives here's husband would come to the top of the list. So the lists and the wait lists are so different than they used to be. And again, those priority crisis admissions are just constantly bumping down anybody else, any other priority. And we're finding that with the BSTU as well. So they too are a high priority, very similar to that spousal reunification, but they're sitting underneath those crisis admissions and they're not moving. So that's what I'm seeing anyway. I don't know if Jen's hearing and seeing that outside, Grey County, but that's certainly what I see.
Yeah, and so I think I'll also add, I guess the other way we could look at it as an opportunity is if committee wishes, we could work to put some language to support the concept of this being a part of the Bill of Rights, as the private member bill suggests, with some additional language around looking at the prioritization of like the criteria for prioritization. I think it's right now, meets the definition of a wicked problem. There's just too many people needing care, and it's system-wide. So when there's people waiting in hospital that might take priority over a spouse in the community, that person moves in, but that frees up space for someone who's been on a wait list for a surgery. They've been waiting, for potentially a life-saving surgery. So it really is a wicked problem in that there's too much demand and not enough supply to be able to have everybody in the right place at the right time. So I don't know. I've kind of left more questions than answers. Sarah, this is something we could revisit, right? So I could commit to get a little bit more information from Advantage Ontario, see if there's other work happening, and bring this back to committee?
Through you, Mr. Chair, yes. Staff are totally within. Receiving the correspondence for information does not preclude you from receiving any future updates about the topic. So staff
or being directed to go do something else also by committee, right? So that's okay.
And we can note that as direction. I get the sense that that was kind of unanimously agreed from the committee today. So although I do see Councillor Carleton's hand raised, so if there's a preference for a formal amendment, I would defer to the chair and the committee.
Sue, go ahead, please.
Thank you, Mr. Chair. The only comment I had to make, I guess, would be, so people going to a critical list are for physical ailments is the reason that they are needing to go in. Is there any consideration given on that spouse waiting to go in based on the emotional or the mental health, the issues that causes? And is there a way to ask for that to be a consideration? I mean, I know we were very fortunate with my parents for being able to have them together, and that was prior COVID. So I realize things have changed, but there's definitely a mental hardship for those people not being able to be together. So just a question whether there's any importance given to that as well. And thank you very much.
Thank you for that question. And I'll, through you, Mr. Chair, with the update of the Fixing Long-Term Care Act, but it was actually in the previous act that it was updated, there's a specific criteria for eligibility to move into long-term care. And I believe both partners need to meet that eligibility crisis. So I'm kind of looking at the square of Kim and Karen and Stacey and Shannon to make sure that that's accurate. So like in the past, it wasn't unheard of for a spouse to move in who really didn't need the services of long-term care. But now both spouses need to meet the eligibility crisis or eligibility criteria to move in because of those wait lists that we were talking about earlier. So there is weight given to the ability to stay at home, like be able to manage at home or not. It isn't all just physical, it's also emotional, cognitive, etc. So it is a broad eligibility. So there is weight given. There is weight given if the spouse meets the eligibility criteria and is on the list, then there is language to support spousal reunification. And then within once they get into the home, we may not have a room right next door or a semi-private room, but then they are on the top of the list to do an internal transfer if that's what they wish. And then outside of that, there's a lot of effort that the staff in the home do to support a spouse that lives in the community to visit safely, to be involved and engaged in the day-to-day life of the resident who's living in the home. And the pandemic is a good example where there was, I don't know if you recall, there was language around restrictions for visiting, right? And there were rules that only in certain circumstances could a person visit. And we decided to extend those circumstances to the spouse who wasn't living in the home. So the resident was maybe fine. They were doing fine. But the spouse, we could tell, was not doing fine, not being able to visit. And so we decided that that language applied to both. So we do a lot of work in with our designated care partner program, and to really fold in the spouses and partners and families as part of the care team. They're part of that residence team and circle. Not ideal. I get it. I do appreciate that. And it is very hard on couples who have been married 40, 50, 60, 70 years to be living apart. Yeah.
Very interesting, information, and it is very troubling that, based on Kim's comments, about a spouse meeting the criteria, but continually being bumped down because of, and I get the other critical situations. I think, Jennifer, I'm hearing for you that maybe some further speaking with Advantage Ontario and maybe coming up with I think we need to respond to this somehow. We need to, continue to highlight the importance of reunification. I don't know the best way to do that. So is the committee willing to have Jennifer, delve into this a little bit further and bring it back to a subsequent meeting? I'm seeing nods to that. So, Sarah, I don't know if we need anything else in the resolution, or can we just leave it that, the committee is giving direction to Jennifer to bring this back?
Yes, through you, Mr. Chair, that's acceptable. Yes.
All right. So should we add then that we're receiving it for information, but a further report will be brought back to committee? Should we add that in?
If it is amenable to the mover of the receipt of the correspondence, then yeah, I can add that in as one of those friendly amendments that we don't do.
So who was the mover again? Was that?
Warden Milne, I believe, was the mover.
Okay, Warden, are you okay with having that brought back? And the seconder is okay?
Councillor Patterson.
All right. Any other discussion? We'll call the question. All in favor? And that is carried. Thank you very much. You're right, Jennifer. Wicked problem for sure. All right. Is there any other business, Jennifer? Committee members, any other business? Our next meeting date is scheduled for March the 12th at 9 a.m. And if there is nothing else, nice seeing everybody again in 2024, and look forward to seeing some of you on Thursday. We will call the meeting adjourned, and Happy New Year, everyone.
Thank you. Happy New Year.
Happy New Year.
Sorry, Sarah, did I need a motion to adjourn?
That's all right. I think we're good.
Okay, thank you.